Hi there, Angela Pratt with BWTP. I hope your day is going well. So today we're going to talk about how do we recover the lost revenue through patient cancellations, right? You know, several weeks ago, we had to call all of our patients and just say, listen, we're not going to be available for care. And as the weeks go on, we've got all those patients that had to be rescheduled or postponed. So we want to take just a few ways to look at that and say, how do we begin Go Day, right? Let's look at our patient base. Let's build a strategy. And it's first, let's rate our patients. So in dentistry, we've got, let's say, A, B, and C. Your A patient is going to be the patient who honors their appointments, who respects your financial protocols, who respects the treatment that you recommend, right? But we're going to look at the A, B, and C rating a little differently. We will tie in that concept of how well or what type of a relationship we have, but we're also going to do a few other things. So, strategy one, we're going to look at the patients who have no health concerns. They have no existing periodontal therapy. They have no treatment needs, right? That's going to be one category. The next category is going to be patients who are up to date on their hygiene needs, but they have some restorative needs. Then we're also going to look at the patient who has multiple periodontal or therapy needs, right? Because typically they're going to require or desire care sooner than the A patient and the B patient, right? And if we've got that patient that's a 2-star versus a 5-star in relationship to our practice, we might be pushing that patient out a little further. So when we also look at strategizing our patients, we're going to talk about high touch calls. How do we reach out to those patients and have a conversation? How will we contact Mr. Jones? First of all, we're going to make sure that we show care and concern. And how are they doing? Are they well? Obviously, if they're not well, we're not interested in getting them in as soon as possible. So as we create the call log, we must create a language or a script so that it is genuine, it is concerning, it's not a code call, right? The next thing we look at is building priority care blocks in our schedule. If we're going to have to schedule all these patients, we have to be mindful of periodontal therapy appointments, longer treatment care appointments, new patient appointments. If we're so concerned in filling up the hygiene schedules with our hygiene patients, and we forget about those priority care blocks, then those patients with those more significant needs are going to be postponed even further, right? The other is so we've got these patients who have to be scheduled, and then we have to have a team that's able to see them. So with COVID and us returning to our practice, just because we're there, it's not always going to mean that our patients can be readily available when we're open. So I recommend sending out a team questionnaire that says, we, for an interim, would have to expand our hours. Maybe to expand on 2 or 3 days of the week. Maybe you were off on Fridays, then you're going to work on Fridays. Will it be forever? No, absolutely not. But it's just creating a questionnaire that says to the team, listen, I value your feedback. We're going to take all of our considerations and look at those as a whole and find out how we can best build an interim schedule to be able to support our patients through the COVID-19 recovery period. And so once you have your strategy in place to categorize your patients, you've created a language or a script of care and concern, you've determined you've got priority care blocks for your periodontal therapy and your restorative needs, but then also looking at what team availability you can put together, that's a well thought out initial strategy of how do I recover from the lost revenue and the patient cancellation concern. So if you're interested to know more about how we can continue moving post-COVID and getting our lost revenue back up, increasing that profitability, please give me a call. You can reach me at 314-576-1350. You can also go to our website at www.bwtpcpa.com. Thank you again for listening, and I hope you have a great day.